significant progress in HIV care, but we're still dealing with the repercussions of the stigma that you mentioned of the 1980s. When anyone donates blood, tell us about the process.
In our country, we screen individuals ahead of their blood donation along many criteria, and then the blood is then tested for a variety of pathogens, including HIV. So the screening process asks if you are a man, if you've had sex with another man in the last 3 months. And if you have had sex with a man in the last 3 months, you are disqualified from being able to donate blood because you are considered a high-risk individual who might be exposed to HIV. So the truth of the matter is, this is perhaps an anachronistic, stigmatized leftover from the 1980s, because ultimately, blood donation organizations, hospitals, community-based organizations, the Red Cross, are testing the blood. They're testing the blood for a variety of pathogens. So I'm still very, very troubled by the fact that we're rejecting a segment of the population from giving blood when we have the tools to actually test the blood and determine whether it's infectious.
Yeah, and look, the big underlying problem is we have a blood shortage. People are actually dying because we cannot get them blood. We need as much blood as we can get. So, my question is this going on in other countries as well? Like, are gay men banned from donating blood in other countries?
There are 17 countries that have no restrictions, including Argentina, Italy, Russia, South Africa, Spain, and Hungary and France. So these are countries that are equivalent countries. But there are countries that impose lifelong bans on gay and bisexual men, including Croatia and Malaysia and Slovenia. So it's a mixed bag. But certainly the countries that are most aligned with our values, with our economic system, they're taking blood from gay and bisexual men. Now, remember, the FDA changed the window from 6 months to 3 months only a couple of years ago. It's time to move it now and get it completely off the books, because it's not helping our country, especially right now when we have a blood shortage.
Well, that's the big point, and we're on the same page here. We are experiencing a major blood shortage here in the United States. A couple of reasons for that. COVID, the pandemic, there were fewer people donating blood. They didn't want to go out. They had to cancel multiple blood donation drives that were going on. So for a lot of reasons, we have a huge blood shortage. We have to do everything we can, think smart, to get as many people to donate blood. And of course, that is always our plea here on The Doctors. If you can, please donate blood. Dr. Halkitis, thank you so much for all your insight, great information.
Thank you for having me.
Our pleasure. All right, if this conversation has struck a nerve with you at home like it has us, reach out to your state representatives in Congress to tell them you support lifting the restrictions that are now in place that we agree just do not make sense scientifically. And for more information, go to our website at thedoctorstv.com.